surgery, it is natural to feel uneasy or nervous.
Why me?
Thank
I
you.
take such good care of my body. I'm so careful to exercise and I eat the proper foods. I think the right thoughts. Why me?
That was frightening. Very frightening. Because it's that fear of the unknown.
This program reviews your procedure and what you can expect before surgery and immediately afterwards. Knowing what to expect can help relieve your fears. It can also better prepare you for surgery and the start of your recovery.
When they explain me, I'm feeling comfortable.
To understand the procedure, it's important to understand how your heart works. The heart is one of the body's most vital organs. It is a muscle which continuously pumps blood, carrying oxygen and nutrients throughout the body. To do its job, the heart also needs oxygen and nutrients. Both are supplied by large blood vessels called coronary arteries, which wrap around the surface of the heart and feed into its walls. Normally, blood flows easily through healthy coronary arteries, but over time, the arteries can narrow and even become blocked by the buildup of fatty deposits called plaque.
That laying down of plaque encroaches on the lumen or the opening of the artery, which results in a restriction of blood flow beyond that blockage.
When the heart does not receive enough blood and oxygen, parts of it can become permanently damaged and even die. To restore the normal blood flow, coronary artery bypass surgery may be performed. During surgery, a piece of blood vessel from the leg, forearm, or chest will be removed. It will be used to create a route or bypass around the clogged portion of the artery and create a channel for blood to flow. This new channel restores blood flow to the heart so it can receive the oxygen and nutrients it needs to function.
The operation bypasses what? Bypasses the blockage. I frequently am asked by patients, what are you going to do to the blockage? And the answer is, with rare exceptions, we do nothing to the blockage. There's no need.
Before surgery, you will be given a gown to wear in the operating room and be asked to remove jewelry and other personal items, such as contact lenses and dentures. These will be given to a family member for safekeeping. As with all surgeries, potential risks are present. These risks will be explained to you, and you will be asked to sign a consent form stating that you understand them. You will also need to provide family contact information and the name of the person who will assist you when you go home. Prior to surgery, you will be moved to an area near the operating room. Here, you will meet members of the surgical staff who will talk to you about your procedure. You should talk about allergies to foods, medications, and test dyes you have, as well as any eye or hearing problems. Before being moved to the operating room, you will be given medications to help you relax. In the operating room, you will be hooked up to several machines. Little discs called electrodes will be attached to you in order to monitor your heart during the surgery. An IV will be started, providing you with medication, anesthesia, and vital fluids. Once you are asleep, a catheter will be inserted to collect any urine. A tube will also be inserted down your windpipe. It is attached to a machine which will help you breathe during surgery. Heart procedures typically last 3 to 4 hours. During your surgery, your family will be asked to move to a waiting area.
I think it's important for families to remember that that's actual operating time. From the time that patient leaves his room or enters the preoperative holding area till the time that I actually talk to the family or any family member sees the physician or the surgeon can frequently be longer than that.
Your healthcare team will keep your family informed about your progress during surgery and meet with them after it's completed.
The doctor came and he told me that everything is okay. The operation was successful and he's doing well.
When your surgery is completed, you will be taken to the intensive care unit, or ICU. This is where your recovery begins. In the ICU, you will be closely monitored and cared for by members of your healthcare team. They will remain close to you at all times to address your needs.
These are highly trained, very professional individuals who are extremely motivated and really are our eyes and our ears during that critical 4 to 6 hour period following heart surgery.
Initially, when they first come in, a lot of the time spent is getting them settled and make sure we keep an eye on the blood pressure and it all stays within a certain range. Do they need more fluid, less fluid? And that's what our monitoring equipment will tell us.
When you first wake up, you will feel confused and groggy. You may also feel cold and thirsty. You may hear sounds or see and feel tubes and wires connected to you. This may be alarming and cause you to feel anxious. It is important to try and stay calm and relaxed. These sights and sounds are all normal. At first, you will be unable to talk because the breathing tube will still be in your windpipe. It doesn't hurt, but it may feel uncomfortable.
I remember coming to, and out the tube down your throat, and I would suspect that is everybody's problem.
When you are alert enough to breathe and cough completely on your own, the tube will be removed. If you still need oxygen, you will receive it through a small tube attached to your nose or by way of a face mask. You will remain in bed for several hours. When your healthcare team feels you are stable, you will be moved from your bed to a chair. During your stay in the ICU, nurses will constantly check your tubes and vital signs, such as temperature, blood pressure, and heart rate. Your family will be allowed to visit on a limited basis, as you will need time to rest and begin building your strength to do the things you will need to do to get out of the hospital. Choosing one family member whom the healthcare team can communicate with will help make it easier for your entire family to follow your progress.
So you need to rest today while we're doing everything, and then tomorrow we'll need you more because you'll be, have a breathing tube out and be more awake and really relying on his family members.
On a scale of 1 to 10, how much pain are you in?
It is natural to feel pain and discomfort after surgery. Managing your pain is one of the most important aspects of your recovery. The more comfortable you feel, the easier it will be for you to do the things you will need to do to recover. When you feel pain, let your nurse know right away and try to be as specific as possible.
When I need something, go right there. I want them out the buzzing now, they'll come maybe right there.
If you cannot speak, they will ask you questions you can nod yes or no to.
It's very important that the patient communicate with us and we ask the appropriate questions and the right questions to get them to talk to us.
Some pain will gradually go away as you begin moving. Other discomfort can be relieved with medications, which may be given to you orally or through your IV. In addition to pain medications, you will also be given medications to protect you from infections and to keep your heart in good working order. In the ICU, you will begin practicing exercises to improve your breathing and prevent lung infections. It is up to you to take control and perform these exercises to the best of your ability. Controlled coughing will open up the tiny air sacs in the lungs and help you get rid of any excess mucus that collected during surgery.
The more they do it, the easier it's going to get. It's going to be painful at first, but it's the more that they cough and they use a little trick with the teddy bear or the blanket, the easier it gets.
Your nurse will provide a soft object to hug as you perform the coughing exercises. This will relieve some of the discomfort you may feel as a result of your incision.
Yeah, I had a teddy bear. He held close to me, when I got up and I walked around. When I had to cough and everything, I had this teddy bear out here close to me.
Spirometry will help you breathe easier by helping you breathe deeper.
The incentive spirometer is we try to do every hour while they're awake, and that is they have to take nice deep breaths, slow deep breaths. A lot of patients will just slow deep breaths, inhale, and then let it out. And if you do that 10 times and cough at the end of it, that's a great exercise for your lungs. And it helps patients prevent pneumonia. And a lot of patients don't realize that's what they're trying to do.
After surgery, it is normal to have a decreased appetite and feel nauseated. This should go away within a few days. Most patients remain in the ICU approximately 1 to 2 days, although this can vary. Your healthcare team will determine when you are ready to be moved. From the ICU, you will be transferred to a step-down or progressive care unit to continue your rehabilitation. You will also continue breathing and coughing exercises as you gradually regain your strength while increasing your activity level. You may also begin a cardiac rehabilitation program. There is no set time for discharge from the hospital. Most patients remain in the hospital 4 to 5 days, but some may stay a week or longer. The length of your stay will depend on your progress. Before leaving the hospital, you will be told what to expect in the next few weeks and given a plan for recovering at home. A follow-up visit will also be scheduled within the first few weeks of your discharge. Heart surgery is a serious undertaking which is followed by a sometimes challenging recovery process. Knowing what to expect will help prepare you for surgery and help you move more quickly towards a full, active future.
Every day I'm feeling the difference. Every day I'm feeling more strong.
Yeah, I was surgery one day after this year.
I had friends who would come by and visit. They would almost do one of those looks at you and say, well, gosh, you look good. What in the world's going on? We thought you had an operation.
Is there more than one?
Already come a long way in your recovery. This program will show you what you can expect after you leave the intensive care unit and before you are discharged. During your stay here, your recovery becomes much more active. Although most of the tubes have been removed, you will still be connected to a heart monitor.
How did that zoom out?
You will also have access to oxygen if you need it, and continue to undergo routine tests. You and your healthcare team will set goals to achieve before you leave the hospital. This includes increasing your activity level, so you'll feel confident in handling many of your regular daily activities after discharge. While you are expected to do more during this stage of your recovery, you are not expected to do it on your own. Ask questions when you do not understand something, and ask for assistance when you need it. Your healthcare team will work with you to increase the amount of activity you can tolerate each day. This will strengthen your heart and lungs and help build your appetite. Stay positive and put forth your best efforts. Your healthcare team will not ask you to do anything they do not feel you are capable of doing. During this stage of your recovery, you are encouraged to get out of bed whenever possible. This means getting out of bed to eat your meals. using the bathroom in your room, and walking the hallways with assistance.
There is no reason in and of itself why someone has to stay in bed 24 hours following a heart operation. In fact, it's probably not a good idea if they're progressing. We think that they need to get up, they need to get moving, and they need to progress.
Avoid putting pressure on your breastbone while it heals. Have someone help you when you get out of bed, and do not use your arms for assistance. Instead, roll onto your side and use your legs and elbows to push yourself up. When sitting for long periods of time, you will feel better seated in a chair with a firm back instead of sitting on the side of the bed. Placing a pillow under your arms may also help you feel more comfortable, since it helps prevent your shoulders from drooping. Your doctor may also order support stockings to help improve circulation and reduce swelling in the legs. If the stockings are loose-fitting or are so tight they leave marks on your legs, tell your nurse right away. It is important not to cross your legs when you sit because it puts pressure on the veins under your knees, which slows the blood flow. When it is time for you to start walking, you will begin in your room. Wear slippers that fit well and have non-skid soles. Take short steps and rest when necessary. Be aware of your posture and try not to slump. This gives you better balance and helps you breathe deeper. A nurse will assist you at first. Once you become more stable, family members may assist you as well. Your healthcare team will teach you specific exercises to help strengthen your legs and upper body. You may perform these exercises several times a day. As you become more active, these structured exercises may be phased out. You should continue to perform your breathing exercises. They will help clear your lungs and strengthen your breathing.
It is extra important to just get it in your mind to breathe nice and deep. That's why we like them to get out of bed. You can sit up.
Controlled coughing will open up the tiny air sacs in the lungs and help you get out any excess mucus that collected during surgery, which can cause pneumonia and other health problems. In addition to controlled coughing, you will continue to use your spirometer. It is important to do the spirometry exercises 10 times every hour or as directed by your healthcare team. During your stay here, you may also begin a cardiac rehabilitation program, which includes counseling and exercise sessions designed to help you live healthier once you leave the hospital.
We not only emphasize the monitoring and the cardiovascular fitness, but diet and lifestyle changes that improve the results of the operation.
It is normal to experience some pain and discomfort after surgery. This may include a sore throat following the removal of your breathing tube and soreness caused by increased activity. The incision areas in your chest, legs, or arms may feel especially uncomfortable.
The only pain I had, this I thought remarkable.
Can I call you back
I
in a
didn't
few
have
minutes?
pain with it.
Okay, I will.
No pain.
Bye,
I know it did. Most of my pain is sitting in my leg. But the veins at that was last few days.
The site of your incision may feel tight, sore, or numb, and may look bruised or slightly red in color. It will take about 6 to 8 weeks for these areas to heal completely. Managing your pain is important. The more comfortable you feel, the easier it is to breathe and move around. It is important to continue to listen and communicate with your healthcare team. Let them know right away when you feel pain and discomfort. By actively working with your healthcare team, you will feel better, which may lead to a quicker recovery.
Mr. Thomas, do you feel like going on a walk?
There have been no pain.
No pain? Yeah, well, I noticed that you haven't had anything all day long, so I went ahead and just brought you something.
I thought if you took some pain medicine, you'd feel more like getting up and out of bed.
Yeah, I go after those pain pills. I'm doing all right.
I think if you take one of these pain pills, you'll feel a lot better. You'll feel like moving around. You'll build up your strength, and I guarantee you'll get out of here a lot sooner.
You know your pain best. Be as specific as possible in describing the pain you feel.
We use a scale of 0 to 10, 10 being the worst pain, 0 being nothing, of having their pain goal being 4 under, or basically what the patient can tolerate.
I guess I am a little surprised that I don't have more pain. The pain I have is moderate to light, and the nurses usually are able to give me something to take the edge off a little bit, so controllable.
Some pain will gradually go away as you become more active. Other discomfort can be relieved with medications, which may be given to you orally or through an IV. In addition to taking pain medications, you might ease soreness by changing positions often, elevating swollen legs, and practicing relaxation techniques. In the hospital, lack of sleep, medications, change in routine, and the stress of surgery itself can take its toll on your body and mind. You may experience feelings of depression or sadness. You may even feel like crying for no apparent reason. Irritability, anxiety, loss of memory, lack of concentration, and unusual dreams are all common after surgery. Over time, these feelings should go away.
Post-surgery depression is as common as pre-surgery anxiety. It's almost the flip side of the same coin, the realization that the big event is over. I'm left with my discomfort and a realization that while I have gotten over surgery, I have a chronic illness, coronary artery disease, or I have valve problems that are going to require constant attention.
Deep, controlled breathing and mental imagery are relaxation techniques you may find helpful.
I pray. Prayer is important. Church prays and family prays and
When your mind and body are relaxed, it is easier and often less painful to get out of bed and walk. You may also find that relaxation exercises help you sleep more soundly.
Come on. Put it on my lap for now.
There is no set time for discharge. Most patients remain in the hospital 4 to 5 days, but some may stay a week or longer. The length of your stay will depend on your progress. When your vital signs are stable and you have reached the goals you and your healthcare team discussed, you will be ready to go home. Individual discharge instructions will be provided. Following surgery and your stay in the ICU, there is still more you will need to do before leaving the hospital. Actively working with your healthcare team during
I'll bring you
and aid in your recovery
an extension cord
help you
tomorrow.
move more quickly towards discharge.
Patient is the key to success. If the patient doesn't own responsibility to their breathing, I can't breathe for you, to their pain control, I don't know when you're hurting, to just being motivated to getting up out of that bed, to eating right, to taking your medications right when you go home. It's really important for the patient to follow the program.
It's been great as far as wanting me to expand what I'm doing. They let you kind of work at your own pace, and as soon as you're comfortable, you kind of try to move up to the next level. I was surprised how things progressed, covering how well I felt.